Thousands of Oklahomans are waiting for the U.S. Supreme Court to tell them if they were going to be able to keep their health insurance subsidies. Depending on what the High Court decides sometime this month, most people in healthcare and state government say that they can't prepare for something that they can't predict.
There have reportedly been meetings at the state capitol over what to do if the U.S. Supreme Court strikes down the monthly subsidies that more than 87,000 Oklahomans receive each month to pay for their health care insurance. But no one in state government will say what options were discussed. The governor and other top state officials have all resisted various components of the Affordable Care Act, including the issue that now could cost 6.4 million Americans their health care coverage. Attorney General Scott Pruitt earlier this year pointed out that Oklahoma was the first state to challenge the legality of the subsidies. At the Oklahoma Hospital Association, members received this flyer, which lays out in plain language what is really at stake in the case now known as King versus Burwell. Oklahomans either get to keep their health care insurance or face the prospect of losing what for many of them is something they've never had before.
The very real pain that will be inflicted on huge numbers of families in each of the states if the subsidies are struck down by the Supreme Court.
Ron Pollock with Families USA says without the subsidy, the monthly premium for thousands of Oklahomans will triple.
The average monthly individual premium with subsidies is $89. If the subsidies are withdrawn, it would increase to $295.
Hospital Association Executive Director Craig Jones has found several options the state has should the High Court throw out the subsidies, and Congress is unable to take the steps necessary to keep the Affordable Care Act intact.
The most obvious option that would be to their benefit would be if the state went ahead and established its own exchange to permit the subsidies. Now that's a political issue right there.
If the High Court rules against subsidies, it would probably take effect in August. So the first option has the added benefit of probably ensuring health care coverage is not interrupted.
The state could probably have something up and going within 60 or 90 days. It doesn't require legislation. The governor could do it with an executive order. The question would be as to whether or not you would operate that under a state agency, which would be the quickest and easiest way to do it.
Or the state could set up a public-private type exchange.
It would still probably be based in a state agency, but you would contract out enrollment or eligibility activities and certain functions.
And there is yet a third option.
But that would take much longer, would be if you wanted to associate with a exchange in another state. There are interstate kinds of options.
Blue Cross and Blue Shield of Oklahoma has the lion's share of those 87,000 new insurance policies. While it is known that the company has spent considerable time talking about possible impacts from the court case, their public statement shares no insight into what the company might do. For now, as we await the Supreme Court decisions, things do not change. We will provide updates as they become available. At the Oklahoma State Medical Association, Executive Director Ken King says they are also taking the wait-and-see approach, but King says if the subsidies are struck down, the impact will be felt by everyone, whether they have insurance or not.
If they don't have coverage, where do they go for coverage? And that's usually through the most expensive means we have out there, and that's through the emergency department.
There is the state's Insure Oklahoma plan, but that needs a yearly extension from the federal government and is very limited on who can sign up, which gets back to the state's decision not to expand Medicaid under the ACA, even though the state's Insure Oklahoma plan works off the very same dollars.
Insure Oklahoma relies upon federal funding. It can't exist at its level without it. And so accepting those federal dollars are all right, but from our standpoint, we'd like to see them accept the additional federal dollars.
If the subsidies are struck down, Craig Jones says we will see a real test of political will.
If there's a political will to move in a certain direction, that's all it's going to take to practically be able to do it. There's all kinds of options out there if we want to take it.
A recent poll by the Kaiser Family Foundation found 63% of Americans want Congress to pass a new law that keeps subsidies going. 55% want Oklahoma and other states that did not set up a state-based exchange to create one.